It is time now for our financial moment with Heidi, where we break down the choices that shape our financial future. In part 2 of this series on Medicare, we're taking a closer look at the coverage details that often surprise people, what's included, what's not, and how to plan ahead. Heidi Hughes-Camp-Collins is here to break down some of those out-of-pocket health-related costs that Medicare will not cover. Heidi, welcome back.
Great to be here.
Thank you so much. I find this series that you've put together incredibly interesting. So one thing I want to do really quickly before we get on to today's bullet points, if you will, is just review what you talked about with us just last week in case anybody missed it, because I would hate to have somebody go, I never heard her talk about that. So in part 1, things that Medicare typically does not cover, here on the screen: cosmetic surgery, acupuncture, dental care, which we found somewhat surprising, eye exams and glasses, which oftentimes are covered by an employer, but as soon as you do Medicare, it's something you have to think about, and hearing aids.
Yes.
So I will agree with you. Some of those were very surprising to me. So moving on now to part 2, you've got 4 additional surprises for people today.
Yes. And the first one is prescription drugs.
Yeah, wow.
Now, again, we don't think of it when we're working for an employer, or if we're covered by the ACA, we get our drugs paid for.
Right.
But when you get to be Medicare age, you either have to have that Medicare Advantage plan, that Part C.
We talked about, yeah.
And sometimes those cover drugs, or you have to buy a separate policy, which is called a Part D drug plan.
Okay.
And you need to check your Part D drug plan every single year, because what's called the formulary, or what drugs are covered, changes from year to year.
Oh, okay.
So you want to make sure, maybe your doctor made changes, as far as your medications go for the year, but also the insurance company that you're covered for could make changes. So you want to make sure that you're covered.
Yeah, good to know that those things can absolutely change. Routine foot care, probably not going to be covered by Medicare.
No, most of the time you're going to have to pay for this out of pocket.
Okay.
But there are a couple exceptions. Now, one big thing that folks go for foot care to their podiatrist or to their doctor for is if they're diabetic.
Okay.
Okay.
Oh yeah. Okay.
Diabetes is a covered illness. So if you're diabetic and need to go to your doctor for foot care, that is covered.
Okay.
But for all the rest of us who are not diabetic, you probably are going to pay out of pocket.
Probably going to pay out of pocket. Good to know. Medical care outside the U.S. We were just talking about taking trips during the commercial break. That is something that's not going to be covered.
Yeah, and people are surprised about this. They don't even think about it.
Right.
But if you have regular Medicare, you're not covered. If you go on vacation. Now, some ways that you can get around this. If you are under regular Medicare, Part A and Part B, and you get a Medicare supplement, some of the Medicare supplements, you will have to check the one you have. Some of the Medicare supplements will pay a percentage of out-of-country care.
Okay.
If you're under a Medicare C or Advantage plan, some of those cover some medical costs.
Okay.
And if you don't have either of those, what you can do sometimes is check with your travel agent.
Sure.
Because sometimes you can get a travel insurance policy.
That's good to know.
So that's something
wonderful.
too.
Especially if you are a traveler. A lot of people, of course, wait until retirement to do a lot of their traveling, especially overseas. So it's something good to know. And then the final one, long-term care in a facility or at home, not necessarily covered.
You know what? I thought everybody knew this, but no.
No.
This is a big surprise to a lot of folks.
Oh,
I have people come in to me several times a month and say, well, if I need to go into a nursing home, the government's going to pay for that. Oh no, sorry. So sorry. Medicare does not pay for that.
Wow.
So what happens is Medicare, if you are released from a hospital and you need to go to a facility to rehab for 30 days, 60 days, that may be covered.
Right.
But long-term care in a facility for skilled nursing care or custodial care is not covered.
Okay.
It's not covered in your home either. So what has to happen is you have to be covered by Medicaid, which means if you're a married couple, you can keep your home, you can keep one vehicle, and you have to spend out all your assets to $2,000.
Lots of good information, as always, from Heidi. Always surprises. Thank you so much. And a reminder, Heidi and her entire team can help with short-term goals like this or major financial milestones. To learn more, visit her website, hhcinvestments.net. You can also see our segments together by visiting kwqc.com and clicking the tab for Quad Cities Live. Heidi, incredible. Thank you so much.
Thank you.
We appreciate